This week, we all heard the World Health Organization make a kind of announcement that I don't think any of us were quite ready to hear again so soon.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Monkeypox. The WHO has now declared it a public health emergency, something they did in January of 2020 with COVID-19, just 2 months before they later, as we all know, declared it a pandemic. I know what a lot of you must be thinking. This feels a bit too much like déjà vu. Surely it cannot be happening all over again. Another virus, another public health emergency of international concern, maybe even another global pandemic. I mean, we're not even done with the last one. The WHO, though, says this announcement is meant to galvanize countries into responding by increasing awareness, bringing in new public health measures, getting people vaccinated if need be. But what if it's too little, too late? Some public health experts are saying monkeypox is already a pandemic. Writing in the Washington Post earlier this month, scientists and doctors Eric Feigl-Ding, Yanir Bayam, and Kavita Patel criticized the WHO for downplaying the outbreak of monkeypox. As of Tuesday, CDC data shows the virus has infected over 17,000 people in almost 70 countries where the virus hasn't typically been found before. It's historically been in the countries with the blue dots you see in West and Central Africa, but is now spreading rapidly. On July the 1st, the WHO sounded the alarm that monkeypox cases had tripled across Europe in just 2 weeks. And as of just this week, the US now has the most known infections, according to the CDC. We're number one again in the world. Yay, America. Now, the good news is epidemiologists have been studying monkeypox for decades. The first reported cases in humans were back in 1970, and there have been other outbreaks of the virus, including here in the US in 2003. And not only do we have vaccines, we also know who is most at risk right now.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
Part of that strategy is to offer sexually active gay and bisexual men, the community at highest risk right now, the vaccines first. The CDC says the risk of contracting monkeypox in the US is, quote, believed to be low, but you could still be at risk if you come into contact with someone who has it. Last week, the first 2 cases of monkeypox in children were confirmed in the US, likely from sharing a household with an infected adult. So, how is the Biden administration responding? According to the Washington Post, the administration is weighing this week whether to declare the monkeypox outbreak a public health emergency and may also name a White House coordinator to oversee the response. The Post reports that officials also have raised questions about whether such a declaration is warranted for a virus that has not been tied to any confirmed deaths in America so far. Over on the right, how are Republicans responding to the latest public health concern? Well,
we have a new global pandemic. Have you heard about this? Monkeypox, that's right. It's the newest thing. It's the newest thing. Listen, you guys have to update your social media right next to your Ukraine flag and your mask emoji and your vaccine shot emoji. You need to make sure you have a monkey emoji, okay?
Yeah. It looks like this latest global health emergency, the second one in just 2 years, is about to become as politicized in America as COVID was, if not more so, because the right has had 2 full years to wallow in conspiracies about masks and about vaccines. Meanwhile, some health experts are saying we have to act fast and that monkeypox may already be endemic here in America, astonishingly. As former FDA Commissioner Dr. Scott Gottlieb tweeted on Sunday, if we have allowed monkeypox to become an endemic virus in the US, which is becoming an increasingly possible outcome, it will be among the most unfortunate public health failures in recent times. Unfortunate? That's an understatement. If that is the case, if it does become endemic, if it's already endemic, it will be yet another shameful and reckless failure by the richest country in the world to deal with a public health emergency. Joining me now are Dr. Anne Rimoin, epidemiology professor and director of UCLA's Center for Global and Immigrant Health, and Dr. Stephen Thrasher, professor at Northwestern University, columnist at Scientific America, and author of the upcoming book, The Viral Underclass, The Human Toll When Inequality and Disease Collide. Thank you both for coming back on the show. Anne, let me start with you. You've worked on monkeypox in the Democratic Republic of Congo since, I believe, 2002, where you founded a program to train U.S. and Congolese epidemiologists on diseases like this. What do we in America right now in 2022, what do we need to know about this virus?
Well, we need to know that this virus can spread very easily from person to person through skin-to-skin contact, contact with lesions, body fluids, fomites, these contaminated materials. You know, there are a variety of different ways it can spread. While it is spreading in the MSM community primarily right now, it can spread anywhere. And it's not a function of who you are. It's just contact. We've seen cases increasing in Africa for decades. We know a lot about this virus, but there's still a lot we need to know, and we need to understand it in the context in which it is spreading now.
The U.S. government, Anne, has made a point that there have been no deaths from monkeypox so far. I seem to remember Fox going on about how there were no deaths from COVID back in February, March 2020 when they were defending Trump's non-response. How deadly is this disease compared to COVID or just in and of itself?
Well, this virus has a range of mortality rates here. We've seen very few deaths in this current outbreak, which is linked to the West African clade, which has traditionally somewhere between 1 and 3% case fatality rates. I work in the Democratic Republic of Congo, where it has a much higher case fatality rate of up to 10%. But what we have to really understand here is it isn't just about mortality. This is also about morbidity, about people suffering from a disease needlessly. But the stakes are much higher, actually. If this virus becomes endemic in human populations, and this is another virus we're going to have to deal with, we're going to have to manage in an already overloaded health system. Furthermore, this virus is traditionally a rodent virus. It's a virus that resides in animals. And I am very concerned about reverse spillover back into a rodent reservoir. And that means that we really will have to deal with this virus here and everywhere globally where we're not already having to deal with an endemic virus. This could be a very big burden on the health system. So it's not just about deaths or no deaths. It's about other things as well.
Very good point. Very good point. We kind of ignore the burden on our healthcare systems again and again. And Stephen, you have written extensively about the failure of our political establishment and our healthcare system to tackle COVID, the ongoing pandemic. Does this feel like deja vu to you? Are we failing again, and in the same ways or in different ways?
I would say we're failing in slightly different ways than with COVID. It's more like HIV and AIDS in the United States in its early years. And I would actually stress a little differently that everyone everywhere should not be worried about contracting this virus. Everyone everywhere should be concerned about it being a problem and should help the people who are most in the path of it. But 99% of the cases right now outside of the endemic countries in West Central Africa are happening amongst men who have sex with men. And so it's really important to name that, to treat that, and to go to the places where that's happening to treat people. And what feels like the biggest failure out of the COVID pandemic is we built up some infrastructure for delivering vaccines quickly, and we certainly have an extremely willing population willing to take them. Every gay man I know, including myself, have been very, very willing and trying to get this vaccine. There just hasn't been enough of it. And I would say in the cities where it's been the most present, the health systems have been pretty prepared to quickly activate themselves and to get it to people. I was able to get one that was put together at a gay sauna very quickly by a community group once they got it. But it was extremely angry. Sorry, I was just going to say it was angering to see in the New York Times yesterday that the Biden administration had an option on 300,000 doses they could have brought in quicker and they chose to wait and see how it played out before getting those into the arms of people where it was moving and stopping onward transmission.
And Anne, Stephen's raised a point about which communities are affected, as have the CDC and the WHO. The overwhelming number of people who've been affected in the current outbreak are men who have sex with men, we're being told. The WHO and the CDC have both explicitly warned about the threat to gay and bisexual men. Can you just explain to our viewers where that threat to this community comes from? Why are they so vulnerable to this virus? It's not an STD, is it? Just to be clear for our viewers.
Well, I think it's really important to remember that this has been an escalating threat in low resource settings in DRC, in Nigeria, in West and Central Africa for a long time. And we are seeing a dramatic increase in cases in those places as well. So it's important to remember that this is, this is something that's also a problem in Africa. Now, here, what we're seeing is spread primarily in the MSM community. And this just has to do with it got into a community that has social and sexual networks. It's facilitating the spread. This virus has many mechanisms for spread. Close contact, which sex is an example of very close contact, is an important way of this virus being able to spread, just close contact. And so because we're seeing this kind of intense social and sexual network, it's giving it a lot of runway to spread. Furthermore, the vast majority of the population that are sexually active and out there, you know, they've never been vaccinated against smallpox. So remember, vaccination here in the United States stopped in 1972, and in other places, you know, some places a little earlier, some a little later. But most people don't have immunity to pox viruses from previous vaccination. So, you know, it's hitting a vulnerable population, a lot of runway with a lot of contact. So it's taking advantage of that and spreading.
Stephen, Guardian columnist Owen Jones, who is a prominent British gay journalist, he tweeted on Tuesday about countries that are prioritizing giving the monkeypox vaccine to men who have sex with men first. And he said, those trying to make this sound homophobic, quote, have completely lost the plot. It would be homophobic to deny gay and bi men priority for the vaccine. How do they not understand this? Do you agree with Owen? Is that the right way to prioritize vaccinations, or are you worried about this becoming stigmatized as a gay disease and then ignored like HIV was in the 80s, as you mentioned earlier?
No, I agree with Owen 100%. I would actually argue that we should think of it as a sexually transmitted infection, which doesn't mean that it can't be transmitted other ways. But if you look at the CDC website, herpes, HIV, hepatitis B and C, all of these are called STIs because sex is a domain where these diseases are transmitted. They're transmitted through unsterilized syringes and other ways, but sex is a major vector where we need to address them. And so I think we do need to prioritize this community, which one, as you were starting to bring up before, will not just stop death, but will stop real suffering. I have numerous friends who have this right now. They are suffering tremendously, and no one should suffer like that. And they are going to be physically marked from it at a very dangerous time in the United States when we have hundreds of anti-gay bills around the country where, because of the ruling from the Supreme Court, basically trying to reverse Bostock, that people can be fired again, you know, or moved out of schools or not given accommodations. They're not protected by federal law the way they were just a few weeks ago. So if they're outed by monkeypox, that's going to put them in real danger. And this, we get a lot more bang for our buck going for the populations where the vaccine is moving the most. So if it's moving amongst men who have sex with men, that's where you treat it, because that's going to, as your other guest was pointing out, that's going to stop movement going to other people. It's going to stop animal spillover. That's where we want to deal with it. But I do worry a little bit about if people think this could happen anywhere at any time, which in one way it can. If 1% of straight people start making a run for this vaccine, it's going to make it much harder to get the little bit we have to the people who are most at risk right now.
So you've just set me up for my last question before we run out of time. I have to ask you, Anne, on the vaccines. The administration says we have 300,000 vaccine doses ready to distribute. They say we have more than any other country in the world, but there could be millions who need it quite soon, eligible for it. Do we have enough vaccines? And are there any health downsides to these vaccines that people should know about?
Well, I think that, you know, it's really important to get as many vaccines as possible out to the populations that are at most risk, which right now is the MSM population. And so I think that that's really, really critical. Do we have enough vaccine? No, we don't have enough vaccine. We need to have a lot more vaccine available. So the sooner we get vaccine out there, the better off we're going to be. And as your other guest mentioned, that it's very important. This is a population that is very open to vaccine, very interested in health-seeking behavior here. So I think that we've got to get this vaccine out as quickly as possible. That is our best defense, in addition to testing and great surveillance, because if we don't have situational awareness, we're not going to be able to attack this and to really limit the spread of this virus.